Thank you, Justin. And it was a very insightful and a wonderful talk. It described a lot of new concepts with reference to social health and public health. I am very thankful to Pakistan Health Parliament and, of course, Sadr Zaman Saab and Anaya for arranging this talk today. Um, Actually, the concept of social health has been coming into limelight increasingly daily on a daily basis. Historically, when we review the history of public health, the history of health systems, health was more sort of an individualistic concept. So people getting ill or people having problems, and they were moving to some physicians, traditional healers, spiritual healers, different forms of health providers. People used to go to them in intimacy and in privacy, of course, in confidentiality. They will share their problems, and the healer or the medical provider or whatever the name that was, the service provider was, they will give them remedies and tell them some, medication and some other advices. But if you see the history, the concept of social health evolved when there was advent and there was the introduction of public health into the system, where the health, instead of taking care of as just one uh, free from disease concept. So initially, in old times, we used to define health that as an absence of disease or infirmity. So if you are free from disease, you will be labeled as healthy. But later on, we found that there are so many diseases, there are so many problems, which most of the people they can transfer from one to another. There came the eras of epidemics, the eras of pandemics, and you and we all witnessed a very huge pandemic of COVID since 2019 to 2022. The 3 years of pandemic also highlighted the role of social health in public health. So when we go back into the history, we find that whenever there was an ailment where one person can transfer the disease to another person, and the propagation of disease is linked with some form or some sort of or form of social interaction, the role of public health emerged as one of the main pillar in health systems. So on one side, disease is a lot of the personal problems and personal discomfort, personal issues with body and mind, and a lot of things which are known to the person who has the disease or their health provider. So it is in between a patient and the doctor or health service provider in many cases. But in recent times, both groups of diseases, which Justin highlighted as one group as the communicable diseases or infectious diseases, and on the other hand, there is another very high burden of non-communicable diseases coming up as a big threat to the world. So, if we talk about infectious diseases, this is something which spreads from one person to another, in most cases through a vector or through some agent, and there is a lot of social interaction involved in transfer of those diseases. So, if we compare this recent pandemic of COVID from the last 100 year ago Spanish flu, which also became a pandemic, and it was also a viral disease. The transfer of agent and the transfer of disease from one person to other, in this case, in 2019 and 2020, was 10 times or maybe 20 times faster as compared to 100 years ago, because we have faster ways of communication, we have faster ways of movement from one place to another. So in December 2019, it was contained inside China, but within January 2020 and February 2020, it traveled to Thailand, Korea, of course Italy, and then USA. It came into Pakistan in February 2020. So within months, because of this air travel, because of this fast travel on the motorways, because of this fast travel on ships, better ships, and a lot of logistics movement, not only just humans but also a lot of trade going on between countries, this issue of spread of disease from one place to another has become really problematic. And that is the area where Pakistan, in the last joint external evaluation, what we do is for the evaluation of public health, we have a concept of joint external evaluation by UN partners. So there's a WHO, then there are some UN partners who go to the country and identify some of the indicators of disease spread, and then they identify the risks to the country and risks outside the country. So the latest joint external evaluation of the UN partners and WHO, I was part of one of that in March 2024, and we found out that Pakistan was, and the report was released in March. The process is 2 years long. It started in 2023, but in 2024, we came to know that Pakistan is doing pretty well in many indicators of international health, and global health, and social health. But the problem of risk communication is the worst in Pakistan. So whenever there is a epidemic, there is like cholera epidemic, or there is hepatitis B, C, or HIV sort of outbreak in some area, or infectious disease outbreak in some area, the risk communication score was very low. So once the public health goes out of hand and the individuals, they are not able to protect themselves and others in the vicinity, the society has to interact. That is the role of social health, and it is one of the strongest pillar of public health, where health is considered as one of the social phenomena. There are two important things. We are good to have that Miss Shaista Khan is here, parliamentarian, because health policy is always political globally. So whenever there is a policy making, it needs the involvement of policymakers, and most of the time the policymakers are politicians, and the policymakers are mostly executives who are running the departments of the country. So when there is a system like this where the disease spread is fast, you have to act very fast, and you have to safeguard the policies of the country and the region, so the infection is contained within one demarcated zone. So Pakistan is unfortunate, where not only we have a very high burden of infectious diseases. Around, I think, 2 days ago, there was a World Hepatitis Day on 28th July, and on that day, I was having an interview with Voice of America, where there was a report. They made a report on Pakistan and how this hepatitis B and C is spreading in Pakistan. It's a huge burden. About 12 million Pakistanis suffering from hepatitis C, and only half of them know that they have hepatitis B or C. So once they go to a health facility, they got their blood tested, they come to know that they have this problem. Now, knowing hepatitis B and C makes you careful, although you can start the treatment, and there are many options where you can stop the spread of disease to another person. But when you don't know you have hepatitis B and C, and your tendency of using more injections, or going to health providers and getting IV injections, getting giving blood donations, or having some of the dental treatments or medical technology or use of some equipment, it creates a lot of infection spread. Same is the case with HIV, and many other diseases. So social health has a very high level of importance nowadays in Pakistan, because of the simple reason that we have very high prevalence of almost all the infectious diseases. Imagine that the incidence of tuberculosis in Pakistan is around 400 plus. So we have 400 new cases of TB per every 100,000 population. So within 100,000 population, you will get 400 new cases diagnosed as tuberculosis, and we are talking about 250 million people. So you can imagine what is the burden of it is. I think fourth or the fifth largest burden of tuberculosis in the world is in Pakistan. We have 9% Pakistanis who are suffering from hepatitis C, and only half of them actually know their status, and even half of them, so half know it, and the half of the people who know it, they actually get the treatment. So it's a huge gap between the knowing the status and then going to the practitioner and getting their course of treatment for hepatitis C completed. Hepatitis B, 4% Pakistanis, and when we talk about 9%, 4%, 6% of 250 million, you can imagine how many people there are. It's like the whole population of many European countries, which are so equivalent to a whole one country. We have the number of hepatitis cases in Pakistan. Similarly, tuberculosis I already mentioned, and then malaria and other sporadic infections of cholera and typhoid. They are very common because of water and sanitation conditions. But I will like to mention one more thing, that in addition to this issue of this infectious diseases, a very high burden of non-communicable diseases is now coming up, and that is also a social health problem. So it's not just the infectious diseases which has become a problem for our social ailments or social health. The issue of non-communicable diseases is driven by lifestyle. So most of the lifestyle we adopt, they are socially adopted. So we eat and go out and eat junk food as a social, practice. And our social culture and cultural norms have changed from eat natural to eat fast food. There are a lot of agencies and different types of apps which provide you fast food within few minutes of your order at your home. So you don't walk, you don't do physical activity, you don't control your weight, you don't actually sleep for proper time during which you should be sleeping. You are awake, and then you order junk food. And this is a social phenomenon nowadays. It's a college life, it's the hostel life, it's the social life of the youth nowadays. They sleep in the day and they wake up and socialize at night, and they order this junk food and they eat sodas and colas and these high calorie foods, and then they don't go for sports. Very few Pakistanis. I'll tell you, I did one of the survey for physical activity in Pakistan. It's a similar of BRFSS, which US does, the behavioral risk factor surveillance, which is done by USA every year. We adopted one of the questionnaire from there, and HSA, Health Services Academy, and Heartfile, Dr. Sani Anishtar, we did some surveys in Pakistan. Only 10% Pakistanis, they do actual physical activity on a daily basis. 90% Pakistanis, they don't do any physical activity. They think the way they work, the way they do their labor or their household chores and whatever they are doing physically, it's physical activity, which is not. Physical activity is any exercise which you do in leisure domain, not at work or not in stress of your offices or of your household. So 10% Pakistanis reported to have doing at least 30 minutes physical activity, a walk or anything else, at least 5 days per week. And 90% said, no, we don't do any type of physical activity, which is very, very dangerous. So about 30% of the Pakistanis, according to a lot of studies by Aga Khan, Tazeen Jafar, Karachi, have shown that the hypercholesterolemia in this country is like doubling every 5 years. So it was 20% around 10 years ago, and a few years ago we did another survey, and it was around 40% in the youth, in adults, young adults, less than 29 years of age. So in young adults of Pakistan, the cholesterol level is at that level where medication is required. What to talk of anything? You must have heard that diabetes, Pakistan has one of the largest or the highest prevalence of diabetes in the world. 33 million Pakistanis, which is not even equivalent to, again, I'll say it's the population of a whole of a country in a Europe continent. We have the number of diabetes as 33 million in Pakistan, which is around 17% of the total population. So these illnesses, these problems of non-communicable disease like hypertension is also around 300 million Pakistanis. 25% Pakistani adults have hypertension. Um, every hour, this is a reported figure I'm telling you. I work for the Armed Forces Institute of Cardiology, the National Institute for Heart Disease. Every hour, 47 Pakistanis die because of a heart attack. It is one of the highest in the world. Now, every hour, 47 means 1,126 in a day. Never ever in the 3 years of COVID, Pakistanis had such high mortality.